Hi, so today I'm going to show you how to set up E-line tubing. You're going to need a couple of things before you get started. So you'll need your 500 ml pressure bag, you'll need a 500 ml bag of normal saline, a blunt tip needle, and then your A-line tubing. So all of this can be found in your A-line kit that is located in your clean supply closet. So the first thing that we'll do is we'll take our 500 ml bag and take our blunt tip needle, insert the blunt tip needle into the IV admix port, and this is to remove any air that is in the bag so that air does not enter your tubing, and so air doesn't enter your patient then. Next, you'll take your priming spike of your A-line tubing and insert it into your bag. Then you'll take your pressure bag and insert your 500 ml bag into the pressure bag. There's a little hook on the inside of the pressure bag that you can use to hang the IV bag on so that it doesn't slip out. And then place this up on a IV pole. Next, you'll inflate your pressure bag. So there's a stopcock on your pressure bag. Make sure that the stopcock is pointing outwards on the pressure bag so that you can inflate it with air. And then just keep pressing this like you're pumping up a blood pressure cuff. And you want to inflate it to 300. So there's a little dial on the pressure bag that'll indicate when you're at 300, and it is represented as green on this dial. So keep inflating. And then you'll see that it is green at the bottom here. Next, you'll squeeze your drip chamber until it is all the way full, and then come over to the other part of your A-line tubing. So there's a couple different parts of your A-line tubing. As you come down from the drip chamber, you'll see your roller clamp. You really don't have to do anything with this. Make sure that it's open so that you can prime everything. Then you have a connection here at the bottom before the transducer. Make sure that connection's tight. And there's another one at the top here. Make sure that that's tight too, so that no air gets into your tubing. Next thing is, this is your transducer here. On the transducer, there's a little blue pigtail that we'll use to prime it. Then you have your stopcock up here, and then here you have the vamp. The vamp will be open when you take it out of the bag. My suggestion is to close it by just pressing it gently. That way you don't have to prime all of that, and there'll be minimal air in your tubing. Next thing, we'll come over to your stopcock. We'll flip it up so that it's off to the distal end of your tubing, but it is on to the rest of your tubing, proximal end. Then take your pigtail catheter and pull. This will prime your tubing. Make sure that you prime it until all the air is expelled from the tubing. Then you'll turn the stopcock back to the neutral position as it was when it came out of the packaging, and then you'll pull the pigtail catheter again to prime the rest of the tubing. Again, making sure that all of the air is expelled from the tubing. And that's it. You have a primed A-line tubing. If this was for a fresh A-line insertion, I would hang this on the side of the bed where the provider is inserting the catheter so that they can reach it, or you can hand it over to them too. Once it's inserted, then you'll follow the steps for zeroing your A-line catheter. Thank you.